most obese countries. With this rising obesity, there is a rise in health concerns. So today, with Dr. Neha Gupta, Senior Infectious Disease Specialist, we will have an insightful Health Par Charcha and understand the misconceptions associated with obesity. 4th of March is observed as World Obesity Day, and it calls for action to manage and respond to obesity. This year, it is themed around changing perspectives. Let's talk about obesity. Let's talk about obesity and get expert insights from Dr. Neha Gupta. Doctor, thank you for joining us.
Thank you so much, Ritika. Thank you for having me here.
It's our pleasure. We would like to know what is the reason for increasing obesity.
So, there has been definitely many changes which has happened in our lifestyle over the last few decades. Earlier, definitely we would work more manually. There was a lot of hard work which was going on. Everything we would do it on our own. But now, there have been changes in our lifestyle. A lot of times we are using the help of machines, so the amount of work which we do has gone down. Plus, there has been changes in our diet completely. There is a lot of focus, especially even if we look at it now, there is marketing strategies. Kids are more inclined towards junk food, including pizzas, everything, and that is one of the main reasons for resulting in obesity. So sedentary lifestyle, less of exercises, more of dependence on the mobiles as well as machines, and not taking regular care of ourselves with less physical exercise and more junk food is responsible.
Can you discuss the connection between metabolic health and obesity, and are there personalized approach to weight loss given individual metabolic differences?
Absolutely. So, obesity and metabolic health, they both are interconnected. So we have patients who are obese or they have more BMI, body mass index. They are more prone to have other metabolic diseases like diabetes as well as cholesterol or the dyslipidemia. So there is going to be high cholesterol levels for them. So when there is obesity, it results in insulin resistance, like type 2 diabetes mellitus. So our body or pancreas becomes less responsive to insulin, and that results in high blood sugars or type 2 diabetes mellitus. Besides, when there is obesity, it produces a low-grade inflammation in the body, as a result of which many other organs, including the heart as well as the liver, they get impacted, and it results in non-alcoholic fatty liver disease. And this in fact is one of the most common causes of chronic liver failure. It's not hepatitis B, it's not alcohol, it is the non-alcoholic or metabolism related fatty liver disease which is responsible for the chronic liver diseases. And whenever there is obesity, it will also result in increased cholesterol. Cholesterol, diabetes, all of them get interconnected. Most of the patients who are fat, they will have these diseases in common, and these problems will occur in a single person. So if one thing is there, especially if there is obesity, especially if it is abdominal fat, that is a risk factor for diabetes, fatty liver, the liver problems, as well as for the heart-related problems, as well as stroke, which is the CNS. In fact, stroke is it's becoming much more common in India now. How do we tackle this? Every patient is different. There has to be individualized approach in managing obesity. That will depend upon your current lifestyle, how we can, the diet as well as exercise patterns. So it has to be tailored diets as well. So it's important to consult a healthcare professional or a doctor or a registered dietitian for this, so that we can have an individualized treatment or approach for reducing the weight.
Doctor, can you tell me the risk factors associated with obesity, and are there steps that can help us manage weight?
So, risk factors can be genetic from the beginning, then it can be environmental. So, a lot of people have it comes from the genes, so there is obesity. But a lot is because of the environmental and our own habits. Remember that weight is 80% diet and 20% exercise. So even if you're not able to find a lot of time for the exercise, but if we just have a little mindful eating, we can probably control our weight. So if suppose you're feeling hungry, so rather than having chips, it's better to have some fruits or vegetables as snacks. Having nuts will be a little better than having something else. And always, even we can't do much, but don't have a heavy dinner. Take a very light dinner, maybe perhaps a soup or whatever. If you're having chapatis, then please cut it down and have early dinner and go for a post-dinner walk. Have lots of water. Water is very important, and having little lukewarm water helps in increasing the metabolism and decreases the appetite. A lot of times we feel we are hungry. It's not the hungriness because of food. It is the thirstiness which makes us feel that we are hungry. So water content, if is good, that will reduce the intake of food as well. Yes. And focus on fruits, vegetables. Have 5 fruits in a day, and different colors will help in that will give antioxidants and will also improve the skin complexion and make you overall, it will make you more beautiful.
You are beautiful, and I know the secret now. A proper diet is what makes you look so beautiful. Thank you so much, doctor, for joining us, taking time out, and it was a pleasure meeting you and getting expert advice on maintaining weight. Thank you so much.
Thank you so much, Ritika, and thank you to Redcliffe Lab.